bio is being read, you don't rush to the podium. You let people look for you. But I have a short story to tell, but a question to ask first. In the country Kenya, which is the county that is known for people who don't speak good Swahili? Anybody? Which is the county with the people with the poorest Swahili speakers in Kenya? Come from which county? Omagbe. Correct. So, fortunately or unfortunately, that's the county that I come from. And so, several years ago, somewhere in Omagbe, there was a crusade. How many of you have ever attended a crusade? Several. So that's good. So the crusade was being held by a Protestant church. You know Protestant churches? Protestant churches are mostly churches that pray on Sunday, but are not Catholic most of the time. So, and if you've gone to some of these sermons, the preachers are normally very powerful in terms of how they deliver the sermon, and there's always a lot of energy. So, normally, towards the end of the preaching, upon the Holy Spirit to shake. And there are several people mourning and crying, and there are several people also praying. So, as this pastor was preaching, the pastor is not very popular. But because this is a no-shave November, he had very long beards. I don't see anyone here with very long beards. He had very long beards. And so he was preaching, and at the back of the church, a woman started crying and shouting and rolling on the ground. So if you've been to such sermons, what is the assumption? The Holy Spirit has descended. So the pastor continued.
Wait, just a minute. Or the person is like, it might be the Holy Spirit or the other. So it's either of the two.
Either of the two. But the Holy Spirit has descended. That is why the other one is acting up. So the woman is shouting and rolling and crying, and the pastor increases the vigor in his preaching. So he comes off the podium, walks down, goes at the back of the church, and he prays for the woman, and the woman is still crying. So as you know, when these sermons end, the pastor will call those people who want to receive Christ and get saved. To the front to be prayed for. Unfortunately, this woman was not among the people who came forward to get saved. And the pastor was concerned because he looked in the crowd and he didn't see this woman. So at the end of the sermon, he said that the usher should bring that woman to the office to talk. And so they sit with the woman face to face and they start talking, and they ask her, what's the problem? What are you going through? And I told Pastor siku hizi pia wamekuwa counselors na psychologists. So they ask me, what's happening in your life? How can we help you? Are you together? So this woman starts talking. But in the process of the pastor talking, the woman was constantly looking at the pastor's face, looking at the floor, and the tears rolling on her face. So when the woman talked, she said that, Pastor, I'm a widow. My husband died 6 months ago, and life hasn't been easy. So you see, when I saw you, I just became emotional. So the pastor asked, why did you become emotional? And the woman said, you see, Pastor, when my husband died, he left me with one goat. I only had one this goat disappeared. And this is the only thing I had from my inheritance. And Pastor, when I see your beard, it reminds me of my goat. Are we together? When I see your beard, it reminds me of my goat, because my goat was so big. The goat had a very long beard, and your beard looks exactly as my goat's beard. So when I saw you preaching, and then you were talking and shaking your head, I just remembered how my goat was walking around and the beards were shaking. So that is why I was crying. So you can go to the next slide. So I'll be talking to you about meaningful adolescence and youth engagement. And the reason why I brought that story was just like the speaker before me talked about, designing and implementing with young people. Meaningful adolescence and youth engagement is very critical in sexual reproductive health. What normally happens is that you might sit in a podium or stand in a position of power, like the pastor, like where I am standing right now, and look at all of you and assume your problems. The pastor thought that the lady alikuwa ameshikwa na Holy Spirit, only to realize that the lady alikuwa anakumbuka her goat. So I'll give you an overview about what PS Kenya does. I won't delve a lot into this. I think majority of us, if you've not heard about PS Kenya, we've used a number of PS Kenya products that are available in the market, or you've interacted with PS Kenya programs. So PS Kenya is Population Services Kenya. It's a local NGO registered in 2014, and it's part of the PSI network. And we have our office is not very far from here, on Lerana Road, but we have other two offices regionally, and we have presence in all the 47 counties in Kenya. We can go to the next slide. And we are focusing on strengthening health service delivery, social behavior change communication, health system strengthening, catalyzing the private sector. We normally talk about using a total market approach in healthcare. Actually, when you are talking about private sector engagement and health systems resilience on day one, I wanted to suggest that all of us take the total market approach course. It's free. And you learn about healthcare financing and so on. So it's a free course on the Global Health Learning Center. You can go and look for it. It's, I think, 2 hours. It won't cost you any money, but it comes in handy. Economic empowerment for youth and social franchising for health. So other cross-cutting themes that we look at are social inclusion, digital adaptations, monitoring, evaluation, and learning. Next slide. So I'll talk about Adolescent 360, which is the program that is part of the partner supporting this event. And this is the program that I'll focus more on in terms of meaningful adolescence and youth engagement. So Adolescent 360 Amplify is phase 2 of implementation, and phase 1 of implementation was done in Nigeria, Tanzania, and Ethiopia. And after the first cycle of funding for 5 years, Children Investment Fund Foundation and BMGF, Bill and Melinda Gates Foundation, realized that even though they were reaching adolescents, they were not reaching the most vulnerable adolescents. And they needed to extend their learnings beyond, needed to extend their learnings and interventions to more vulnerable adolescents, and that is how Kenya came in. So the program works with public health systems primarily in pursuit for sustainability and continuity of the innovation. And the process for designing this intervention was done through what we call human centered design. We'll do a short capacity building in the afternoon, so I won't delve into that much, but it's about designing with the end user. So going to the ground and talking to the actual end user, not getting a few representatives to represent the views of adolescents and youth. And then we are looking at combining sexual reproductive health, adoption, continuation, and agency, and looking at life skills, financial planning, and entrepreneurship to bring a holistic approach. And that is why it is called 360 or 360 degrees. And then meaningful adolescence and youth engagement, it's central to the approach, not just in the design phase, but all through the implementation, and I'll share how we do that. And then we are focusing not just on contraceptive adoption for adolescents, but also continuation. But there is always a caveat to it. When you say continuation, there is continuation with need, so those who need. And then we are targeting primarily about 50% of the intervention, targeting adolescent girls 15 to 19 with their partners and influencers in the community. Next slide. So this program currently is being implemented in 3 countries, and each country has a local name for the program. So in Kenya, the program is called Bitishupavu, and for Bitishupavu, we are leveraging on storytelling as a catalyst for behavior change and also access to service delivery. So we realized that actually our design phase for the program to develop Bitishupavu, we took 10 months. Was ever seen a program taking 10 months for design? So we did our research for 10 months, the community with adolescent girls and the community members to come up with this intervention. And we see Bitishupavu as a catalyst for amplifying the voices of adolescents in their communities and in the global spaces. I really wanted to bring a few adolescents to this event, but due to the nature of the activities, I didn't see their participation becoming meaningful in the activity. But most of the time, in most of the conferences that we go to, we normally bring an adolescent, not cherry-picked young people with college degrees, but those adolescents at community level, the vulnerable ones that actually these interventions go to. Next slide. So I'll go straight to the adolescence and youth engagement strategy, and there's a whole story behind. Just go back. Not that slide. The slide with the strategy. Next slide. Yeah, that one. Oh. So there's a whole story behind it. A360 used to do very well with youth engagement. So for youth, we are meaning people up to 24 years. And mostly we used to engage people like you. But what's the project targeting? The project is targeting predominantly adolescent girls 15 to 19 years. So most of you here may not represent a girl in Narok, true or false? How many of you here are married? How many of you got a child before they turned 18? Then you see. Now, that is why we had a problem, because you've gone to the university, umeishi maisha mzuri, umeenda shule, and we expect you to come and represent the views and voices of vulnerable adolescents in the community. Now, there is how we can be involved in it. You come in very handy when you're talking about matters of policy. But when you talk about matters of program adaptation, the value that you are adding will be very minimal, because you are very far from the problem. You are not part of the problem. Are we together? So we developed a youth engagement strategy looking at inclusion and looking at inclusion of most vulnerable adolescents, consultation. Most of the time, when you bring interventions to adolescents, they're told, we brought you this, now you can try it and tell us. And if it refuses to work, actually most of the programs, for those who have been in implementation, when we close our programs, we don't even give feedback to the adolescents. They just realize that, for example, let me use an example. Afya Nairobi, if there's, I know there's no such a problem, but Afya Nairobi ilienda. The people, the community who are being served by Afya Nairobi have no idea, so there is no consultation at all. And we are looking at capacity building, and this happens when you are brought to a forum to participate or represent young people and you don't know anything they're talking about. Have you ever been to a forum? You've come to discuss policy, na una habari unaongea. So we go to all the time, umenyamaza, and they can write reports and take good photos and say, Noel was there, youth representative. You didn't say anything. You didn't contribute anything. So we saw it wise that capacity building before involvement is very critical, so that you can be involved meaningfully. Usikue tu hapo for kupiga mapicha. And then accountability and governance. Youth engagement normally hainanga indicators. Inakuanga kama side chick ya program. So it's not measured, it's not evaluated. Inakuanga tu PowerPoint. Most of the time it's tokenistic. Utakuja, utalipiwa transport ya kukuja, they say yes, we compensated them transport, they went back, take good photos, youth representatives. You'll be taken to a conference to go to present youth, and you'll be told what to go and say. Whatever you're saying at that conference is not what, it's not representing the views of the people that you've come to represent. And then, of course, adaptive learning and mentorship. Adaptive learning is mainly changing on the go. We implement as we look back and make changes on the go. Next slide. So I'll look at how we've been able to engage adolescents in the program. Next slide. And I'll be focused mostly on the adolescents with a little bit of youth. So we have a governance structure. You have a governance structure, and that's how it looks like. So you have community adolescent forums representing where the adolescents are engaged at community level. I'll explain more about that. We have peer mobilizers, we have youth innovation champions, we have a country panel that is multi-sectoral, multidisciplinary. So from research, M&D, service delivery, quality assurance, demand generation, and so on. And then we have a global steering committee and an advisory board. Next slide. So one of the ways that we've engaged youth is through structured capacity building, and I just highlighted a few trainings that youth have gone through. So this is basically for youth, not for the adolescents. And I wanted us to take a keynote here. So all the youth that we engage in the program are all contracted and are program staff. And they have access to all the benefits that PS Kenya provides in terms of capacity building for all the staff, which is a good thing, right? But it takes a lot of negotiation to get that happen. Next slide. And then we have leading digital strategies and life skills and economic empowerment. We realize that engaging youth without leadership is a problem. Most of the time, if you're a young person supporting a program, you're always under someone. Your work is to take instructions, unaambiwa to go left, unaambiwa jump, you ask how high. So we realize that it is important to give youth areas to lead. And for life skills and economic empowerment for the program and digital strategies, it is 100% youth-led. They came up with the indicators, they developed all the collaterals for the program. They measure in fact. Okay. So when we go to adaptation meetings for those areas, we are normally there youth wearing another hat of a technical person. So we sit back and let them lead the process. So they tell us what to do. So hapo at a project manager and even the global project manager for the program, anakaanga chini and let them lead that area. When it comes to all the meetings they need in that space. So it's a good thing. Next slide. So this is where we are talking about adolescents engagement. And this was one of the local adolescent forums. I had gone to visit them because one of adolescents in that photo was supposed to attend one of the summits here in Nairobi last year. And I wanted them to give me a person. So this, we have a component of life skills training and economic empowerment. And one of the things we came up with was these forums where after girls receive this training in the community, we form a learning and savings group. But that is not where it is important. The loans and savings group is supposed to ensure that there is continuity in that engagement. This group is handed over to the facility in charge and the community health assistant that is attached to that facility. And they become the patron of that group, and we normally ensure that they're given a space within the facility to meet on a weekly basis for table banking and their meetings and things like that. Now, why this is important, it gives us an opportunity to have organized groups of adolescents giving us feedback on the program. Secondly, they are able to support the facility in terms of feedback on adolescents and youth issues. So the facility, normally we know how our public facilities run. They don't have a lot of resources to go and pay transport for adolescents to come to the facility to engage in a discussion. So the interaction is normally patient to facility. So with these groups, the facilities are able to work with them. If, for example, there is some feedback that is required, they're readily available, and they know the service providers in person, so they're able to provide referrals easily. So just beside that, to ensure that they are not suffering, we normally give them a startup kit as a program for the group of between 5,000 to 10,000, based on what they say they want to do with the money. Next slide. And we have adolescent-led outreaches and mobile clinics. When we are talking about nothing for us, without us, youth leadership, this leadership has to be nurtured. Now we are used to working with CHPs, but other adolescents were like, of course, CHPs. Yeah. So we capacity build them on demand creation and facilitation. So Bindishpavu is a very detailed program that has a lot of tools. So we take them through all these tools and are able to mobilize girls from their community, conduct a full Bindishpavu session, of course with the collaboration of the service provider. So the facility in charge normally assigns them a service provider from the facility to go to those outreaches. And they have support from at least one CHP to support them. The important thing is that we pay them the way we pay CHPs for similar activities, because compensation for youth is equally important. So you have to compensate people for their work. So we pay them, but they don't do the work because we pay them. Actually, they're the ones who told us that they wanted to do those activities. They told us that why can't you, mnapeananga facility, for example, 2 outreaches a month. Why can't you give us 1 outreach as adolescents so that we also learn and do it? And from running those small activities, we realize that when other organizations come to run their new programs, these are the people they take as their mentors because they have experience. So still lazima, some of this experience you can't get away in school. Next slide. So what are some of the lessons that we've learned? One is that girls are eager to build meaningful connections with the health systems. And the problem is normally they don't get the opportunity to get these connections with the health systems. Daktari, for those who know our male clinical officers at the facility, so wakisha that kwa dust coat, na amekaa kwa kiti hapo, ana move just from one room to another, alafu anasema next, ama unaitwa jina na unaingia, ukimaliziwa unaenda. So they don't get the opportunity to know these people in person. And one of the issues for adolescents in sexual reproductive health is trust and confidentiality. If I come to this service provider, do I know them? Do they know me? Are they going to treat me well? If you give them an opportunity to interact with these people closely, then it builds trust. Adolescents ni kama wamama wa kununua nyanya kwa soko. If most of the ladies who go to the market know that ukinunua nyanya mahali na na upewe nyanya imeoza, especially usiku, and you go home and you find nyanya mbili zilikuwa zimeoza. You'll tell all your friends, so and so in that market anauza nyanya imeoza, don't buy from there. That is how the adolescents interact with our health facilities. Secondly is that girls in most facilities are engaged by the health system beyond A360 and SRHR. Tuliona kama adolescents wanaenda kumobilize for immunization programs. Immunization arise, wako hapo, wanaenda pia kulipwa na county government kama CHPs, because now the facilities know them. They are engaged in water sanitation and health activities beyond sexual reproductive health. And then the forums have enhanced demand perceptives. We have around 35 forums, and if you compare in terms of adolescents and youth accessing contraceptive services for facilities that have these forums and facilities that don't, the facilities that have these forums are posting more numbers for people accessing services. And does that say this can actually be a channel for sustainability, because we've relied so much on donor funding. After this 360, the funding in Aisha in June 2025, they're not happened. So this is an opportunity for sustainability. And then linkages to opportunities outside A360 have also been amplified. I talked about linkages, and lastly, engagement of adolescents have opened facilities to peers. If you know someone from your community who goes to this facility and you know that they talk to the facility in charge, they're a leader in the forum, it's very easy for you to talk to them, and they actually bring their peers to the facility. Wakikama washika mkono. Unataka kwenda kwa hospitali, unaogopa, hata nikupeleke and get yourself sorted. So that's it from me. I don't think there's something else. Unfortunately, I didn't put my contacts there. They should have been there, because people normally told me about Google Mashinani, even though. So I normally put my name there. Thank you very much.